Hello everyone and welcome to this webinar on care planning in older adult care homes. What I'm going to do, hopefully you can all see my screen, is start off with a little bit of housekeeping. So you may have noticed that we're recording this session, but we're only going to share the presentations after the event. So none of the discussion or the breakout rooms will be shared. But if you're concerned about your face being seen on our recordings, do turn your camera off, and you can do that normally in the bottom left-hand corner by pressing stop video. You all should be muted during the presentations, and we'll unmute you for discussions. Do feel free to take comfort breaks as needed. We will be having a short breakout session about halfway through where you'll be separated into two separate rooms. If for any reason you don't want to join those breakout sessions, you need to have a break, that's fine. Don't join the rooms, but don't put the call down, just wait around in the main room. Do feel free to use the chat to make comments or add questions for the team. We will try and either answer in the chat or come back to them in the Q&A session at the end. And we will be sharing our slides after the event, so there's no need to make furious notes. Okay, so I suppose let's start off thinking about the objectives of what we're doing here today. And really today is about bringing people together, bringing actually different people with different experiences and different viewpoints together. People with lived experience, be they residents of care homes or their family or friends, with social care professionals such as those who work in care homes, and bring them together with researchers. And despite, I think, all these different perspectives, I'm assuming that all of us share a common interest in kind of ensuring that the care of older people who live in care homes, the care they receive is as good as possible, and that residents in older adult care homes routinely experience really good quality of life. And care planning, when done well, can help us understand residents' lives, their needs, and their preferences. And when we talk about quality of life care planning, all we actually mean is care planning that focuses on a resident's quality of life, how they experience and live life. As opposed to care planning that perhaps solely focuses on addressing medical needs or addressing a condition. And many care homes are already conducting care planning in this way. But today what we want to do is share our work that's looked at approaches used in care homes and has asked social care professionals about their views and experiences. But we don't just want to share the work we've done. We want to, hopefully via polls and discussions and chat, give you the opportunity to comment on and respond to the work we've done. But as we're only halfway through our work, what we also want to do today is share some of our plans for the next year and a half of our work, and again hear your comments on that. Also, we'd like you involved to be more than that. So what we're going to do at the end of this session is share some of the ways in which you can be involved in the research, take part, and so forth. And so that's what we're going to work through today, is currently doing an introduction. We're going to work through the findings. We're going to have a little session on the involvement of our public contributors, talk about the next stage of the studies and opportunities to be involved. We've got Liz Jones from the National Care Forum and Natalie from the National Association of Activity Providers to do a panel session, so they'll be responding to our work. Then we've got our question and answer session, and we should be sort of rounding up and closing by about 4 o'clock. And I just wanted to do, before we move on to talk about the findings, is just mention our project team and the project. So this work is funded by the National Institute of Health and Care Research through its Applied Research Collaboration Programme, and it's part of the National Priority Programme for Adult Social Care and Social Work. And it's led by the University of Kent, but it also involves our wonderful public advisors, but also 5 universities representing 5 ARCs. I'm not going to read out every name, they're up there, but a number of those will be speaking today. We've got a website you can look at, but I also need to point out that any views expressed today are not those of the NHS or NIH or Department of Health, but of the authors. And so the work we're going to talk about today was really all about the development or further development of quality of life approaches towards care planning in older adult care homes. And what we did and what we can talk about is a scoping review of the literature, interviews we did with social care professionals involved in care planning, some work on developing a framework to understand what person-centred care planning entails, and then looking a little bit at extension plans, which are a consensus process with stakeholders to develop best practice care planning principles, and a small pilot and evaluation of specific quality of life approaches to care planning. And so what I'm going to do now is hand over to my colleagues Jackie, Laura and Jono to take you through the findings.
Brilliant. Thank you very, very much, Nick. Hi, my name is Jono, and I'm going to be kicking off this short session by talking about a scoping review that some colleagues and I were involved with towards the end of last year. So if those of you who are interested would like to find out more, you're welcome to read the whole piece of research at the website indicated on the slide at the moment. We've also included a QR code. So to start with then, what is a scoping review? Well, it's an approach that researchers often take when they want to think about a really big issue or topic and get a sense of what is missing from the existing research, but also to find out what's already being done. And that's what we set out to do with this piece of work. So the aim of our scoping review was to think about interventions, programs, projects that are trying to encourage care planning in older adult care home settings. And what we wanted to do is look around the world and find what's already being done so that we can think about how that might inform going forward and how care planning is done here in England. Next slide, please. So what we did is colleagues and I set out to try and find all of the relevant research, all of the documents that relate to care planning and efforts to encourage its uptake. And we did that by searching in a number of different databases. We were a bit startled to find that there were around 3,800 articles that related to this topic. And then colleagues and I sort of meticulously went through those, and eventually we distilled that down to approximately 120 articles, which related to care planning for older adults in care homes. And it's those 120 articles and the sort of summary of our findings that we'll be discussing this afternoon. So next slide, please. So what did we find? Well, we noticed that the interventions which were designed to promote care planning did so in a number of different ways. The most common being providing training. And that training may have been delivered online or in person. It might be a one-off piece of training or a piece of training done over several weeks or months. But alongside that, we found that a number of care homes were also providing staff or residents or family members with information or resources to help them have a better understanding of what care planning involves and how they can take part in that. And then finally, we found that a smaller subset were changing the way that they carried out their sort of day-to-day practice. So an example of this might be moving towards having regular multidisciplinary team meetings to discuss particular care plans, to think through issues that are arising within a care home. And it's at this point I'd like to flag up our first question to you, the sort of attendees today, to try and get a sense of how you think staff within care homes could be supported to deliver really high quality care planning. So I think Nick's going to share the first poll of the afternoon. So the question we're asking is, how can staff be supported to deliver care planning, and particularly really high quality care planning? Please feel free to tick as many options as you feel are relevant. And if you've plumbed for the other option, please feel free to add your comments in the chat, which will be visible to all of the attendees. So it's great to see the numbers moving up as people think about this. And it's worth saying that at the end of this afternoon's webinar, we'll be reading through the chat really carefully and try and summarize some of the key points that people have raised. So we may not have time just at the moment to discuss people's comments in the chat, but we will later on in this session as part of the Q&A and the wider discussion as well. So please do feel free to add comments as you go along. Okay, I think we're beginning to come to the end of people's answers. Nick, do you mind sharing the results with people, please?
Hopefully people can already see them.
Oh, grand. Okay, my mistake. So what's really interesting, I suppose, immediately is that people seem to be suggesting that care planning and supporting staff to carry that out requires a multitude of different approaches. So not only training, but also providing resources, improving partnership working, but also this issue of staffing levels as well needs to be addressed. And I think these are themes that we'll come back to over the course of this afternoon. Nick, do you mind turning to the next slide, please? And I think we can turn that poll off as we move to the next one. So I think it's also worth flagging up that we were interested in finding out who these interventions were directed at, who was expected to attend the training course or read an information guide. And perhaps unsurprisingly, the vast majority of the interventions we looked at and read about were targeted at staff members, people on the front lines who were either personally responsible for writing a care plan or may be involved in updating or referencing a care plan as part of providing care. But we also found, quite interestingly, that more than a third of these interventions involved family and friends. And I think that's a really interesting topic to think about, because we know from talking to care home managers and staff and residents and family and friends that they can often play a really important part in shedding insights which can influence and inform a care plan. So at this point, we'll have our second poll, and it's just trying to think about whether or not information or training is provided to family and friends, and then also thinking about do you provide training to staff as well? Is that something that's being done regularly or on a one-off basis? It'd be really interesting to understand a bit more about this. I can imagine some of the not applicables will be because people are coming from different backgrounds. So on the call today, we may have people who are family and friends of someone in a care home, residents of care homes themselves, but also then care home staff and managers. So I don't think that's something to be alarmed about at all. And again, if you'd like to flesh out your answer, please do feel free to add comments in the chat as well. That can really help to sort of unpack this issue a little bit more. I think what's immediately striking to me is that of those who have answered about being provided with information and training, there's a pretty even split between those care homes that do provide information and training and those who don't. And that might be something that we turn to in the question and answer session a bit later. I've got one more slide before I finish this sort of brief overview of our scoping review. Nick, do you mind moving on to the next slide, please? So the final finding I wanted to flag up and really get your input on is to do with electronic care plans. And what we found is that only a handful of the studies we found referenced digital care planning. And it may be because some of the papers we were looking at were written up to 10 years ago. But we'd be really interested this afternoon in just getting a sense of how common and prevalent digital care plans are. And that's the topic of our third and final poll from me this afternoon. And I think, speaking personally, this poll is particularly interesting because I think we're anticipating that digital care plans are going to become more and more prevalent. And that's something that seems to be really backed up by people's answers here. It seems that most care homes are either already using care plans, the vast majority, or if they're not already, it looks as if people are planning to, within the next 12 months or so. And then thinking about family and friends, it seems that of those who are aware of someone having a care plan, actually the majority do know that it's a digital care plan as well, which is really interesting. And it would be great perhaps later on in the session to think a bit more about whether digital care plans are something that care homes find particularly helpful, but also residents and family and friends as well. I'm going to pause there and hand over to my colleague Laura, who's going to be talking about some more of our research findings. But thank you so much for all of your participation so far.
Thank you, Jono. My name is Laura Prato. I'm part of the ARC North West Coast, and I'm here to talk through some of our findings from the consultation today. So our key aim was to really understand more about care planning methods and the value of quality of life approaches within care homes. And we had two specific objectives to our interviews, which was the first was to identify and learn from existing care planning approaches within the older adult care home setting. And the second was to understand the perspectives of the older adult care home sector towards quality of life planning and implementation. And if you could change the slide, Nick. So just to talk a little bit about what we did. So we carried out 22 semi-structured interviews, which just means we had pre-prepared questions with professionals involved in conducting, managing or supporting the care planning process within older adult care homes. And we had 12 participants in leadership roles, 5 registered general nurses, 3 registered managers, 1 activities coordinator and 1 GP. And 3 of our participants were based in nursing facilities, 3 in older adult residential facilities, and 14 were in mixed facilities. So there was a mixture of the two. And what we did after we completed our interviews was we discussed what we felt was really coming through from what people were telling us. So what was important about care planning, what were the key aims of care planning, if there was anything that really needed to change. That's it. So these were the 4 key findings, really. So the number one thing that people wanted to talk to us about mostly was the value of person-centred care planning approaches. And second to that really was the role of partnership and involvement. So that was partnership both with residents, with wider family members, and with the wider health and social care team. People also wanted to discuss what happens after care planning has finished. So the fact that care planning is an ongoing process. So it's not something that happens when somebody first comes into a residential care home or a nursing care home, but it's an organic document that changes over time, that's responsive to the needs of the individual. And a lot of our participants also wanted to talk about the fact that there was a need for change and improvement with the way care planning is currently occurring within a lot of residential homes. And we'll talk about that a bit further in the next slide. If you could change slides, thank you. So our participants suggested really that there were 3 main aims to care planning. So the first was assessing resident needs. Second was providing person-centred care. And that was really getting a good understanding of the individual and what mattered to them and what was important for them. And also ensuring the provision of appropriate care. So that was ensuring that individuals are getting the level of care that was right for them and that was also promoting independence as much as possible. There was also discussion around the timing of care planning and the importance of this, that it's responsive, that it changes. And a lot of our participants wanted to discuss the content as well, and that this has a big impact on care planning. So many of our participants discussed the fact that although mostly they wanted to provide person-centred care and care planning, this could be undermined by generic risk assessments, and that sometimes the content itself was not responsive to the priorities of the individual resident and their family, but instead could be more around risk assessments and less sort of person-centred than they would like. There was also discussion of the fact that sometimes there could be an absence of the correct training or the right skill mix, and that this could also have a bit of an impact on whether care planning was person-centred or not. If you could move to the next slide, Nick. So returning to the topic of person-centred care planning, we looked at this in a bit more depth, and we looked at some of the research that was already out there that was led by an individual called Wilberforce, who's looked at some of the indications of person-centred care planning. And we found that a lot of this research corresponded to what our participants were telling us was important. So there were sort of three key indications of person-centred care planning. So number one was understanding the resident. And again, that was about taking a holistic approach, meeting all of their needs. So these were needs that were spiritual and emotional, as well as physical. Another indication of person-centred care planning was around engaging residents in decision-making and family members. So sitting with the resident and making sure that the care plan was responsive to what was important to them. And the third was really about promoting care relationships. So getting to know the individual and having conversations around, tell me about you, what's important to you, what matters within your life. And if you could change slides, Nick. So these were some of the factors that it was clear was impacting on whether person-centred care planning was occurring. So number one was around the intervention itself. So the design of the care planning template or the documentation or the digital care plan. Number two was around the individuals involved in the care planning process. So there being a presence of positive leadership style and individual enthusiasm and knowledge amongst the individuals who were involved in care planning. Third, this was the care home environment itself. So how care planning was being communicated, how handovers worked, and the availability of resource. So that was around things like time, but also having the right staff mix. And the fourth thing people mentioned was the impact of external forces. So to what degree regulatory bodies and health and social care system itself was impacted on the ability to promote care planning in a person-centred way. And if you could change the slide there. Okay. So one of the key things that people felt was really important, person-centred care planning, was around partnership and involvement. So that was the involvement of residents and wider family members, but it was also acknowledged that sometimes this didn't happen, particularly if there was an absence of capacity, or particularly in relation to end-of-life decisions. Again, involving relatives and carers was also identified as really important, but again, it was acknowledged that sometimes this doesn't happen, or was only happening where there was an absence of capacity. There was also discussion that there was hope that the introduction of digital care planning would also really help with kind of broadening that engagement with the wider health and social care system and team. Thanks, Nick. If you could change slide again. Thank you. So there was also discussion about what happens after care planning. And our participants were clear that if the care plan is read and has been done properly, it will extend quality of life and give individuals a better end of life quality as well. But again, there was acknowledgement that sometimes care plans aren't read or they aren't referenced, and that this could be because they're either too long or often due to timing. And if you could change slides again, Nick. So our participants identified 4 real areas for change and improvement that they would like to see around care planning. And the first was around there being more training for staff. The second was around increased time available for care planning. Third was that person-centred and quality of life aspects of care planning are prioritised. And the fourth was around introducing more digital care planning to build those closer partnerships with the wider health and social care team and with relatives. And this is where the poll comes into play. So what we would like to ask you to do is just rank which one of those you think is the most important. It looks like most people feel that it's about making sure that person-centred and quality of life care planning is prioritised when care planning is occurring. So that's really good. It's a really positive thing, and that kind of reflects what our participants were saying as well. And if you could move on to the last slide, Nick. So these are just a couple of questions, really just some food for thought. And if you have any thoughts around this, you can pop them in the chat. And we might return to this at the end when we're having more of a discussion. So really, was there anything about our findings that surprised you, or is there anything that's concerned you or that you feel needs addressing further? and we can talk about that a bit further on, or if you want to have a discussion in the chat, that would be great as well. And thank you very much. I think I'm handing back to you, Nick.
You are, yes. So what we're going to do now is move on to the next session. And that is all about the next stage of our work, so the next year and a half of our work, and opportunities to be involved. And what I'd like to do is hand over to my colleague Yuri to talk us through some of that.
Okay, thank you, Nick. So my name is Yuri. So researcher at the University of Bristol. So in this session, we're going to present a bit about our next plans in this project, and we would like to share some opportunity to be involved in our research. So next page. So this national priority program has now extended until the end of 2025. So during this period, for our next step, we would like to focus more on putting research findings into the care practice. So we have 2 plans for this. The first one will be developing a set of key principles for care planning, working with care professionals and people with lived experience. And also the second one is to pilot a new approach to care planning that focuses on residents' quality of life in adult care homes. So I'm going to talk through these 2 studies and would like to share a bit about information about the opportunity to be involved in this work. So the first one study will be the generating the document outlining a set of key principles to inform the care planning process. So this document would include, for example, key aspects to be considered to make care planning process more person-centered, or what kind of information should be included in care plan documents, or who should be included for their care planning conversations. So our idea is to invite around 50 care professionals and 12 people with a lived experience to reach consensus on these principles. Next, please. So this study has 2 stages. Firstly, we would like to do online surveys with care professionals. So we have created some draft document outlining the key principles for care planning based on our previous studies that we shared earlier. So through this survey, we would like to gather feedbacks on this document to refine this working document. And we are going to do this in 2 rounds. Then once we revise this working document, then we would like to invite people with a lived experience for group interviews. Probably each one will be like an interview with 4 to 6 participants, and where we can explore the response to the care principles, and we can understand their views of what matters to care planning for them. So that's the first study we are planning. So the next one is the piloting quality of life care planning. So in this project, we aim to introduce a new approach to support care planning in adult care homes that focuses on residents' quality of life. So this approach combines several elements to inform care planning process, including staff training and using a residents questionnaire to measure their well-being, and supporting care planning conversation by using these measures. So we are going to introduce 2 sets of care planning support package with 2 different types of measures. One is called ASCOT, Adult Social Care Outcomes Toolkit, and another one is ICECAP, Wellbeing Measures. Next one, please. So we will recruit 4 older adult care homes in England and support for around a year to use one of these tools with the residents, so either ASCOT or ice gap. Then during this period, we will try to evaluate what kind of impact it will have on those involved, and also try to understand what was it like for everyone involved in this using this method. So next, please. Okay, so before moving on to the bit more information about taking part of this research, let us try another poll. So you should be able to look at poll. So have you or an organization you work with taken part in research before? And if yes, how was your experience in being involved in the study? That'll be helpful to know. So it seems like almost half of you have some experience in taking part of the study, and half of you may have not. And looks like experience mostly good, but I think some of them have some mixed feeling about the experience. Maybe you can add some comments on the chat. Yeah, thank you for this. So the next slide, please. So I'd like to share an opportunity to take part in this research. So for the first one is developing a set of key principles for care planning. So in this study, we would like to invite two different types of participants. The one cohort will be a care professional. So this would include anyone who has been involved directly or indirectly in care planning for residents in older adult care homes in England. So this would include care staff, nurses, or care home managers, and also people who are working for their organization to standardize care planning processes. And for the people with a lived experience, we expected to have care home residents and someone with the experience of supporting a family member or friend who is or previously was a care home resident in England. So we have a different task for each group of the participant. So for the care professional, we would like you to complete 2 online surveys. We expected each survey will take around 20 to 30 minutes to complete. And for the people with a lived experience, we would like you to invite a single online focus group where we can have a chat through your views on key principles of care planning. Next, please. So what would be the potential benefit of taking part? So, well, we aiming to develop like meaningful, useful, and relevant documented outlining key principles. So your contribution will shape this co-produced set of key principles, and your participation will ensure your views and experience will be reflected in this key principle for care planning. And also we would like to provide you with a voucher to thank you for your time in taking part. And we also make sure there will be no direct impact on your care homes. Your views and the opinions shared during this period, during this study will be anonymized. So if you're interested in taking part of the study, or if you like to learn more about it, please get in touch with Jono by this email or using this QR code. So the next study, to pilot the quality of life care planning. So we're currently looking for older adult care homes in England, ideally in Kent, Surrey, Sussex, or in northwest of England. This is because some of our researcher member will be affiliated into this ARC region around this area. So if any care homes or organization outside of this area, if your organization is outside of area, that'll be also great. So you can still contact us. So by taking part of this research, we would like you to adapt this new approach to care planning in your care home around 12 months. So during this period, we will make several visits to your home for providing training session and for care staff and support staff to use these measures. Also, to better understand the experience of using this method, please allow us to do some short surveys and probably have some interview with care staff. And also, it would be great if you can help recruiting residents and family members to the study. We also planning to do some interview with them. And also, potentially, it would be great if you could share some anonymized care planning data with us, because that will be very valuable information as to understand how this new method work in what context. So next please. So what would the potential benefit of taking part? So your contribution going to help us shaping this innovative care planning approach that will be more person-centered, and you will actually help us to adapt this new approach in an actual setting. And also involvement in the research usually viewed very positively by CQC. And looking back at our previous experience of working with care homes, residents often enjoy being a part of the research. And finally, we will also make sure to provide their residents and family members provided with a thank you voucher. So if you are interested in taking part of this study or learn more about this, please get in touch with Nick by using this email address or QR code. Okay, so this is kind of a quick poll in this session. So can you tell us what the good research look like? We are planning to do a study setting care homes or working with the care professionals, the people with lived experience. What is your view about the good research in this setting? Maybe you can add any thoughts in your chat. It might be about the kind of relationship between researchers and the residents and the staff, or it might be the timing of the study, or what kind of benefits you're expected to have through their taking part of the research. Yeah, thank you. That's great. Probably you can try add something on the chat later, then we can have a look for sharing some opinions later. Cool. Okay. So I'm going to pass on to Nick for further opportunity to relate into the research.
Thank you, Yuri. Yeah, so I'm going to talk about one final opportunity to be involved in the work we're doing, in the research studies we're doing. So as part of the NIHR Adult Social Care Fellowship Programme this year, our local ARC at Kent, so that's ARC Kent, Surrey, Sussex, is offering a fellowship attached to this project, and it's a fellowship that offers funding to become a researcher working on the project. So you'd be working in the Kent, Surrey, Sussex region, primarily supporting and working on the quality of life pilots within care homes. So you'd be spending time in care homes, supporting the care homes to use the tool, but also helping out with the evaluation. Alongside the rest of the team, you wouldn't be on your own, but alongside being involved in doing the research, the fellowship program both has a set of development apparatus to help you along, but also you can have a bespoke support and training package to sort of help you conduct and understand how to do research. The fellowship would last 18 months, October this year till April 2026. There's an application deadline of the 28th of June. I'm just going to tell you a little bit more about who can apply. So it's really aimed at practitioners or academics with strong links in practice, and it aims to really support and improve research capacity in the social care sector. So ideally it's looking for someone who has some prior research experience and knowledge, but really wants to develop those skills further, develop their experience and their knowledge, both through being part of a research project and being part of a team member of this project, but also via the kind of bespoke training and support package alongside that. To qualify, you'd have to have not been awarded more than £50,000 in research grants in the last 5 years. And you'd also have to be either employed by a ARC Kent, Surrey, Sussex member or an organisation that could become a member. And the kind of criteria is for being a member is universities, local authorities or care providers delivering services in Kent, Surrey, Sussex. I've just seen a question from Liz. It said, is the fellowship full-time? No, the funding would cover roughly 2 days a week to be involved. Exactly how much your time would depend on the kind of breakdown between training and being involved in the project. But if anyone on the call or you know anyone who might be interested in exploring or finding out more information about this fellowship opportunity, then please ask them to email me. My email address is there, or you can use the QR code. Okay, so I just wanted to summarise the kind of next steps of this project. So Yuri's obviously gone through in detail, in a bit more detail, but we're doing two things. We're developing a set of key principles for care planning in old adult care homes, developing them hopefully collaboratively with practitioners, with people with lived experience. And then we're also hoping to pilot quality of life planning in 4 older adult care homes, ideally located near to the universities. But if, as I said, if you're outside of those kind of ARC regions we mentioned, the sort of Liverpool area, Kent, Surrey, Sussex, still contact us. We may be able to support you to use quality of life care planning tools. And yeah, there are opportunities we pointed out to be involved in both parts of the study, but there's also the fellowship I've just spoken about. So I think what we'll do is we'll wrap up now. I wanted to thank everybody for attending today and contributing, all our speakers, anyone who's posted or answered a poll or listened intently to what we've got to say. Thank you for making it a really great session. Anyone who signed up for this via Eventbrite, we've got your email address, and we'll be sending you a link to the recordings of the presentations, not the discussions, a copy of the slides, a short findings document, an evaluation form, and also a link to sign up for a mailing list for future events. So we won't be keeping everyone's emails we've got, but if you are interested in being on a mailing list for perhaps an event we do in a 1.5 years' time, we come back and tell you what we found out in the extension period, then do sign up. And I said, do contact us if you're interested or want any more information on any parts of the project participating, or you're just interested in finding out a bit more about the findings. Do contact myself, or I think we shared John O's email address as well. And And if not, I think probably people get 2 minutes back, 2 minutes to 4. So thank you so much, everyone, for attending. It's been a really great session.
Thank you for having us.
Thank you. Goodbye, everyone.
Thanks,
Cheers.
everyone.